And let's do this, America. That's right. Dr. Mike Sevilla here. And we're going to be having a great topic tonight. And joining me, as always, the convener, the conference chair, the 2016, we can start promoting this.
Yeah.
AAFP National Conference of Constituency Leaders, May 5 to 7, 2016. Get more information at afp.org/leader. The man, the myth, the legend, Dr. Jerry Tolbert. Jerry, how you doing tonight, sir?
Wonderful, Mike. How about yourself?
Oh, it's Wednesday night. It's the fall, and a great topic. I want a big shout out to the people in our chat room already and watching the show live. I want to show off my shirt that I just got at the annual meeting. Family docs are the real superheroes. So we'll have time later to talk about that. We have a lot to talk about tonight. Yes, including wrapping up the annual meeting, the new primary care caucus. But before we do that, I think, at some point, in the future, we should probably have guests on this show, people who really want to talk to us. But if people want to talk to us, you can message us on Twitter and go to drmikeseville.com and we can maybe set something up to chat with us about whatever you want to talk about. So, But our top story here tonight is just this quickly evolving story that was awesome, and then we just kind of like fizzled. Okay. And I'm just going to go through the timeline here, Jerry, and then we can talk about things. So 2 nights ago, about 48 hours ago, I saw a tweet from our friends who are watching us right now, our friends from the Primary Care Progress Columbia chapter, that they said that the Family Medicine Residency Program there, from people who don't know, it's in the New York City area, was going to be closing down, which I was like, well, that's weird. I didn't hear anything about that at all. And then the next morning, which is about 36 hours ago, our good friend Sarah Nozel from New York gave me a tweet and said, hey, this is happening. We should start to let people know about it. And, I'm in my office, yesterday morning. I'm seeing all these tweets come through the Twitter machine. And as I private messaged you yesterday, Jerry, because we planned this already. But my concern was like, I haven't heard anything in the official press. I didn't see any kind of press release. Mm-hmm. And I'll put in the chat room here at 10:40 a.m. yesterday. There was an official press release from I want to get the source right, International Business Times, and I'm dropping that in the chat room here. And I will read from the first story, the original story. One of the top hospitals in the United States, New York Presbyterian Hospital, has planned to close its family medicine center at the end of June 2016. And then that's when all kinds of tweets started happening. People are like, oh, what's going on? People are very upset about this. But less than 2 hours later, I get this tweet back from New York Presbyterian Hospital, and it's timed 12:43 p.m. New York Presbyterian is committed to providing exceptional and compassionate care, blah, blah, blah. We are not closing our residency program. So it was a story, and then it was a non-story. But throughout the day yesterday, and even through today, people were tweeting about this. People were talking about this. And I just got this link tonight, which I'll put in the chat room. This is from the Columbia Spectre. Let me drop this in the chat room, and then people can talk about it here, or people can at least read it. The kind of reversal of the decision, which was very odd. Mm-hmm. It was very strange. And the key part of this article, and don't worry, Jerry, I'll let you in here a little bit.
No, you're fine. I'm following the story here.
So the key part of this article is about halfway down, and it talks about a student town hall. Over 300 students attended a town hall to discuss a decision. There was a dean there who talked about the decision. And it was the quote here in the article, which I'll read in case people don't have access to it. It says, quote, "The hospital made a decision that they reversed their decision. So as of today, we're back to where we were a few weeks ago with all the programs continuing. You've got a copy of the hospital statement and it speaks for itself." So it's very legalese. It was like very creepy. And then they have quotes from students here who questioned it. And even in the press, in the articles that I was reading over the past 24 hours, it's a lot of it is kind of like, people obviously, are concerned. People are a little bit anxious to talk about anything, especially the residents in the program or maybe the leadership in the residency program, especially people who may be applying out to maybe go to a different residency program. I can't even imagine about being a resident in that program and saying, "Oh, do I have to find another place to go next year?" Or how is recruiting going to go for, supposedly next year's class? It's a very, very weird type of thing. So that's kind of my story about it. It's how I heard about it. Jerry, did you have kind of a similar experience about how you first started hearing about the story?
Yeah, I saw Sarah's first tweet go out, and that was kind of when I started digging around, trying to figure out exactly what the story was behind it, to see if there had been any official news, because I know that was not too long before you sent your message. I think I saw it early in the morning. I'd have to check my Twitter feed to remember, because I retweeted as soon as Sarah put that up. But I went digging at that point and couldn't find any official announcements. But then as the day wore on, there was more and more stuff coming out that was kind of the discussion that had occurred beforehand. And it still sounds like there's a lot of, I don't want to call it hearsay or conjecture. It's just, it's shaky foundational information. But the problem that I saw from the beginning was when they started talking about this, if you look at the location and you look at the facilities that are going to be most affected, not only are there residency programs, so you've got first and second year residents who, even if it ended in June, they've got to figure out what they're going to do next year. Their faculty and all of these people seem like they were taken completely off balance by it. Like they had no clue that it was coming, which is pretty intense, even with 6 to 8 months to kind of put that together. And so that's why I started digging around, because I just couldn't fathom somebody shutting down that many programs that sort of just off the cuff. So I started digging to see if there was, has this been rumored about? Have there been other things flying around? And it sounds like for a couple of weeks now, things have been kind of brewing, if you will. And so it's going to be interesting to kind of finally hear, even if there is a final story. I don't know that there ever will be, but to hear kind of what the background was on this, because when you look at the location, like I said earlier, all of these are serving some of the poorest of the poor. I mean, these are places that, if you eliminated what they were talking about eliminating in the literature that I was reading, Washington Heights basically has no primary care. And Washington Heights is one of those places that needs primary care, just like any other inner city area. You got a lot of folks that are in those areas because they have a passion for inner city medicine, that they want to learn how to take care of people in a higher poverty income, lower income setting. And that's a huge thing when it comes to residency programs. There are people that choose those residency programs on purpose just for that reason. So it was really kind of frustrating to read that they were planning on shutting this stuff down, because I've got a lot of friends that have gone into programs like that on purpose. They want to know how to, they want to live in those communities. They want to be a part of those communities, and they want to help improve the health of those communities from the inside, instead of being, the outsider who just tries to throw money at a problem, or somebody who's not really attached to the problem. They want to live there. They want to be a part of it. And that's what primary care, that's what family medicine, they're both about. We are building relationships with the people that we work with. So.
And it was interesting because the original business story said they were closing down the residency programs because of the Affordable Care Act.
That was kind of confusing.
That was like really weird how that was framed.
So one of the things that people have been talking about since the Affordable Care Act went through, and love it or hate it, there are certain parts of the Affordable Care Act that are phenomenal, that have made a huge difference in primary care. There are certain parts of the primary, the Affordable Care Act that, even the most staunchest supporter doesn't necessarily agree with 100%. But regardless of how you see it, one of the arguments has been the insurance-based reimbursements for these sort of a la carte or personal insurance plans, the insurance plans that have been offered by these companies through the exchanges or through other means, they don't reimburse at the same rate.
Right.
And so if you had a certain population that was maybe originally uninsured, and so they were paying cash pay or doing sliding scale, or you had a certain group that was, that you were getting federal money for, which is quite possible. And that's a whole nother thing that we probably need to talk about. But, if that was the case, then you now have these people in this private system that you're getting reimbursed at a very huge discount compared to what you had maybe been reimbursed. So I could see, some of that causing financial issues, but it didn't make sense the way they worded it. You're right. It came across as, like I said, I just feel like we don't have the whole story, and that's the hardest part with situations like this. The interesting thing, like you said, though, is within 2 hours having a reversal is pretty intense. I mean, it's a testament to how quickly social media outcry like that can really bring things to the surface. I mean, there were people that you didn't even necessarily equate to primary care or family medicine that were tweeting and talking about this whole rigmarole.
Yeah, it was weird because I was seeing a lot of people tweeting it, and a lot of people who were kind of in the New York City area, kind of in that local area, and then I started seeing other people pick it up, especially from our FM Revolution type of community. But from what Sarah was telling me is that the students really kind of drove this thing. They were very vocal, and it would have been cool. It would have been really cool if somebody periscoped that little town hall during that. They probably would have been kicked out of school.
Just to be a fly on the wall for that.
Just to be a fly on the wall, just to kind of see, or just to kind of hear what was happening and the exchange and the whole kind of pageantry of the whole thing. And big shout out to the students who are on the ground there.
For sure.
I saw some of them tweeting, and some of them in that article. The primary care progress people, the people on maybe there's people from the people from the FM Revolution that were in that crowd there, or just friendly or favorable to primary care, to get that story out there, and reading some of the press. I mean, that some of the decisions may have been made last week, but just announced 2 days ago or 3 days ago or something like that, which was like really weird. And if they were saying it was something from the ACA, the press or the Business Times probably got that from some kind of press release or something like that, that was released probably last week and embargoed until Tuesday, 2 days ago or yesterday or whatever.
Yeah, it's possible. It could also have been just digging around. I mean, you see a lot of these sites and a lot of these reporters will make phone calls and they'll try to fact check, but you can't always get to that point. You can't always pull that down and see, you'll get confirmation of certain things, and you'll get denials, or you'll get dancing around the subject, and so they have to, it's not news if it's not unique, it's not news, and so they may emphasize some of those more kind of inflammatory aspects, I guess would be the best way to put it. But I think you hit on something earlier, that this has to have been brewing. It's not like you walk in one day and say, okay, we're shutting everything down. It doesn't just happen overnight.
Right. So, I mean, I invite, if there's students out there, or if there's residents or anybody inside the program that want to reach out to me, and if you want to share your story, I definitely understand, not, wanting to feel retribution or, anything like that. I mean, we can maybe work something out to get the story out, but I
we
see.
should get one of those cool things where we like fuzz your face out so nobody knows who you are, and we'll run your voice through the little robotizer so you sound like
or the punishment will be more severe.
or to just start a story on the blog or something like that, because
well, yeah.
yeah, and people have been reaching out to me in the last 24 hours or so and say, hey, I mean, this is something that you need to cover. This is the story you have to get out. And I want to share your story, who those people who are on the inside, because people are interested in your story. People are interested in what it felt to hear the announcement and to be at the town hall, or to talk with your friends about, hey, maybe I need to go to a different residency program next year, because unfortunately, this will not be the first, program that closes and not closes and then closes again. There have been things that, we both been reading that, oh, maybe this was the wrong time, because it got this kind of coverage. Maybe there'll be another announcement that they'll close down, and then, nobody will know anything about it. So, that's what I'm concerned about, is that there's going to be another opportunity for this, whoever it is, the hospital, the residency program, to make a move to close down for whatever reason, and then nobody's going to know about it, and that's what concerns me, and part of what we're trying to do, Jerry, is just trying to get that story out there and to get people talking about it. So I mean, it's really, we have to stand up for each other, because if we don't, I mean, who will? No one's going to do it. I mean, this story could have just happened, and before the age of social media, nobody would ever known about it.
Very true. And right now it's kind of this, we're the blind men with the elephant right now. We've got bits and pieces, and it looks from the outside like, they were trying to do a one specific thing or two specific things. It looks like it's driven entirely by money. It looks like it's driven entirely by this, sort of, I don't know. It doesn't, the whole discussion, the whole conversation is not there. And so having those perspectives from the inside is going to be very important for kind of putting the whole story together and forming something that gives you an idea of whether or not it is a risk that in the future these things are going to kind of come back. If this is going to be something that keeps coming up every single year. I mean, you look back, and you mentioned it's not the first. You look back at places like Duke, who did eliminate their family medicine program, but now it's back. I mean, it's kind of this whole idea of what's the impact of doing something like closing down all of these programs? What's the real impact? Not just financially, but in human lives, even. I mean,
just boiling it down to patient care,
right,
and community care. It's not all about being, no, I mean, location wise, it's not being out in the middle of nowhere. I mean,
right.
Urban America, the urban underserved,
right. High concentrations of people, lots and lots and lots of people. Exactly.
Yeah. So yeah, I mean, if you're out there and you want your story, to be told, you're not alone out there. We're out there. The Family Medicine Revolution community is out there, to help not only, share your story, but spread your story. And we're out there. We're out there for you. This kind of story that just happened, people have said, oh, we should broaden the conversation, about, those orphan schools. An orphan school is a school without a department of family medicine. And for people who are not, in medicine, what that means is that, that there are schools that do not have, an academic department or a home for primary care or family medicine. And, I mean, I think, and, a lot of people think, that primary care is the core, is the root of medical care in the community. And, you can't have, that out there without having a home for it at the medical school level. And, for all we know, I mean, this closure, was just another step towards, bridging out or not having, primary care at that campus, in that community. And that's very dangerous. And that's part of the reason why Jerry and I are kind of, rising up tonight, and encouraging our friends to kind of continue to tell that story. And it's something that we feel very passionate about.
Right. If we don't talk about it, nobody's going to. Somebody's got to get this out there. And there are lots and lots of voices right now. It's taking on a whole new kind of life of its own, which is good. I mean, it needs to be something that goes beyond, 5-10 people. It needs to go beyond the people that are at the center of it. It needs to go to the level of, the highest levels, honestly, of not only the academy, but also of the government, of, the people that are making these decisions. The people that are sending funding their way need to know, hey, you're giving them money to support primary care, and they're not doing it. And in fact, they're doing the opposite. They are literally removing primary care from the areas that are going to need it most. Just an aside, I keep coming back to Washington Heights, and it's a 1.5 square mile area that has about 1,700 people in it.
Wow.
To put that in perspective, my hometown growing up, wasn't even really a town. It had like 15 houses and a post office, but the land area that it covered was well beyond 5 square miles, and there were less than 500 people in that area. So, I mean, the population density there is just super, super high. And so, you're talking about just that small area worth of people having no healthcare whatsoever. So 1,500 people without a physician, 1,600 people without a physician, at all.
Right. Exactly. Yeah. I mean, it's just, just going into the, healthcare disparities of the country as a whole
Right.
is a whole different angle. But I mean, but it's important because, we talk about, in our circles, we talk about, this code word that we call workforce, and workforce is
Right.
just not having enough family physicians, not having enough primary care physicians to take care of the population. And how are we going to take care of all these people if we're not generating enough family physicians, enough primary care physicians out there to do that? And one of the ways that we look at that is we look at the medical school level. We look at residencies. We look at expanding residency slots. There's got to be people out there to take care of the population. And when we see a closure or a potential closure like this, I remember, a few years ago, out in California, our good friend, good friends out there, including Jay Lee and all those, there was a residency program that was going to be closed. And we talked about it on social media, and, at that point that they reversed, and they did not close that program. So we have to, tell our story, using not only this, on Twitter, on Facebook, on any kind of medium out there to get that story out there, because for too long, another soapbox, for too long, we've let other people tell our story. We let other people tell the family medicine story, the primary care story, and it's the wrong story. So yeah, I mean, it's just, and I've been getting all these things in my my Twitter feed about very cool articles. I'm going to try to share them in the chat room here. I'm going to try to, for those who couldn't join live, I'm going to share them in the show notes about the importance of primary care, that we deliver better care. We deliver better health at a decreased cost, and that's the story that you're going to hear from a lot of different venues, including the Health is Primary website, the Health is Primary campaign. That's something that we definitely need to do. So, big shout outs, to people who are watching us live. Feel free to, if you want to, you can type in the chat room here. Thanks to everybody who've been tweeting out the show. This is not a one-time show thing. We want to try to get other people involved. I've reached out to some people, and maybe on a future day or a future evening or whatever, we can talk about this again. This is something that we need to continue to talk about. One of the things I'm gonna drop in the chat room here is something that I saw in my Twitter feed here. This is from 2012, but this is from the New York Times. Great article. Where have all the primary care doctors gone? And I think that's something that everybody should file away or print it out or read it later. Another reason why to continue to make the case, why family medicine, why primary care medicine is great for our nation. And there's probably other stuff that's out there. And feel free to tweet me some articles and links and things. I can retweet them and include them in some of the show notes here. It just been an interesting couple of days there, Jerry. Just
for sure.
It was just ramping up yesterday, and then at noontime it was just like boom. It was just like it was all done. It was weird.
Yeah, it was just a huge, like you said, huge swell. That's actually what I'm doing here. I am paying attention. I'm just looking at my Twitter feed here just to look back and see when the last time somebody said anything about it was, and it was really, I think. Much earlier today. I mean, it's been hours since I've seen anything come across since the retraction. So yeah, it'd be interesting to see kind of how this all settles out in the end when it comes down to long-term change. Is this going to be enough to show that that there are enough people interested in what primary care has to offer and what primary care really means to keep this from being a recurring issue, or is it something that, like you said earlier, that's just going to keep coming back?
I did want to give a big shout out to our good friend who I saw in Denver, and Venus Wilder, MD, and she wrote a letter to our good friend Wanda Filer, the current president of the American Academy of Family Physicians, and she put this on her Twitter feed today, and this is a great letter. So let me just kind of go through this. It says, "Hello, Dr. Filer. I am a former chief resident of the New York Presbyterian Columbia Hospital Family Medicine Program, 2013, and a currently faculty member at the Harlem Residency in Family Medicine at neighboring Mount Sinai in New York City. And a former family medicine orphan from Harvard Medical School. Yesterday, my colleagues and I were shocked to learn about the Columbia program being disbanded, and even more shocked to learn about the reverse decision. As you can imagine, despite our small victory, this is a travesty for family medicine in our urban areas. It devalues our work. It undermines our presence. It blemishes our reputation, and it makes it even harder for us to recruit the type of students that are committed to serving the paramount healthcare needs of our nation's people. I wanted to reach out to you because I think that the National Academy needs to speak out about this. Despite the reversal, it is an opportunity to demand even more than just preservation of the Center of Family and Community Medicine at Columbia, but an opportunity to establish a legitimate department of family medicine at Columbia and other tertiary centers that have refused to recognize our specialty. Even more so, it is an opportunity for us to display no more family medicine nice. We are getting yoked around. I like that. We're getting yoked around and disrespected. At this moment, we can use this as a platform to set our agenda for future of family medicine in primary care and the training programs across the country. Please let me know how I or any of my colleagues can help propel the momentum that has been started in this rude awakening. Sincerely, Venus Wilder, MD." So, yeah, I mean, of course I reached out to her.
Yeah.
We need to get her on this program.
We need people that eloquent on here all the time. That way,
that's right. More eloquent than us.
Right.
So a big shout out to Dr. Wilder, and I've reached out to her, and I would like her to share her thoughts at some point on this, not only on this specific topic, but about orphan medical schools without departments of family medicine. So let's see, what else do I have here? Yeah, I mean, it's it is opportunities like this, Jerry, that that us as a family medicine and primary care community need to take advantage of, because news cycles move so quickly, and people forget about this stuff so quickly that it's hard to kind of keep it current, keep it in the news. And those are opportunities for people who don't want to get things done.
Right. Right. No, I mean, it's true.
Just say, hey, it's off the headlines now. Now we can close the program.
Right. Yeah, exactly. I mean, as soon as people stop looking their direction, then they just go back to right where they were.
Let's see. What else do I have in my files here? Because I knew I was going to forget about stuff here. I think that was all that I had here for right now.
Yeah, I mean that we kind of covered all the major points. I mean, I think until we get more of the story, I think this is kind of where we are. You had this potential closure that's now not a closure, but you really need to keep a very, very close eye on these folks, because who knows where it's going to go from here.
Exactly. So why don't we switch topics here, and we'll kind of catch up on some of the other stuff that's been going on. I did want to talk about. Let's talk about Jerry here, and so Jerry. And want to give a big shout out. You talked about this on one of our previous shows. Your post at AAFP.org, cloudy with a chance of misdiagnosis. That's from the Fresh Perspectives blog, and I will drop a link in the chat room. But for people who don't know what that is, want to describe a little bit what you're talking about there.
So basically, the whole point of that article was to talk about the fact that we have this misconception in the public that everything that physicians say has this sort of ring of gospel truth to it, and it's just not true. As much as the older methods of dealing with patients, the paternalistic model, if you will, kind of makes us think. And so over the last month, there have been several instances where I've had patients say to me or say around me things like, "Man, I miss the days when the doctor would just tell you what was wrong, give you a medicine, and fix everything." and I really have to fight hard not to stop them and say, listen, those days never existed. You're imagining things. Here's some medicine for your case of delusional, psychosis. And so from a standpoint of, what that really means, what the whole purpose of diagnosis and the differential and what that means, and the fact that we have this whole the fact that we have this whole sort of framework of statistical analysis that we're basing things on, that it's not just here's your answer, here's your medicine, go home and get better, and that there's more to it, and that there always will be more to it, no matter how good we get at diagnostics. And so the article compares us to meteorologists, who also are another group of people that unfortunately get a lot of bad
meteorologists.
Press. Yeah. But you're talking about these complex scientific systems, these complex variables. You've got thousands sometimes of variables that you are trying very hard to collate, I guess would be the best word, and put them together into something that approximates an actual diagnosis. And I see what the meteorologists do is a very, very similar thing.
Al, and I think you set this question up here in the chat room, Jerry. How about the use of IBM Watson to diagnose? You talked about that on a previous show. There, do you have a response to that,
did.
Sir?
It's actually in the article too. From a diagnostic standpoint, the adjunct right now, that's an adjunct, and it's a very, very good one. In fact, depending on the studies you look at, about 60% of primary care professionals, and that includes ancillaries and physician extenders, about 60% of the people that they put up against Watson fail. Watson wins, kind of like Jeopardy. So from that standpoint, when it comes to diagnostics and understanding context, which was one of the hardest things that computers had trouble with, Google a set of symptoms and see what comes up. They don't have context. They don't have all of the information. Watson, on the other hand, can collect all of the information and knows what to ask for if he doesn't have it. It learned how to learn, and that's part of what physician training was about when it came to diagnostics. So as far as being a diagnostician, Watson is a great diagnostician, and in the future will probably replace a lot of what we do, because he's going to have access to records that we may not have access to, potentially, and systems like Watson. Watson's not the only one out there. He's one of the best and most publicized, but there are constantly people working on that, and I think it's to be brutally honest, it's the future of medicine. As far as primary care goes, there's more to what we do than just diagnostics, and that's part of the issue. From a standpoint of understanding the diagnosis to then translating that to, all right, well, let's look at this person's socioeconomic status, and let's look at this person's cultural background. Watson eventually, or computer systems like Watson, I don't want to pigeonhole to one system, but systems like that eventually are going to be able to do that too. They are going to be better at some of these things than we are, because they're going to be consistent. Whereas we have a bad habit sometimes of letting our own thoughts and ideas and cultural biases bleed in. Computers don't have those. They're sometimes subject to the biases of the people that program them. But in broad sweeping terms, most of them are going to be free of that type of bias. And so you're going to see a lot of diagnostics moving that way. So I think that's a very good question. And the answer is, I think that we need to start looking more at using things like that so that we are more accurate.
Cool. So you have a future post you're working on for the, what was it? Fresh perspectives, new perspectives, that you can give us a little
fresh perspectives. The answer is not yet. I have had so many posts here these last couple months that essentially just come out of David, and this is kind of the peek behind the curtain here. So David, if you're listening, sorry. We'll have times where there just isn't anything on tap. There aren't people, the people are working on things that the people, every week there's something coming out. And so there are certain weeks where things get really busy, or there are 3 or 4 things that are cooking that need time to really be good. You want them to be solid. And so, so we end up with this, gap in the schedule, if you will. And we try to be consistent, because, if there's anything that you ever learn on the internet, it's that consistent posting, consistent,
that's right. You have to be consistent, not like me, where I'm like not consistent.
Right, or me. Speaking of, we'll talk about this in a second, but that's been my big issue with Ask Dr. Geek Dad, is that I have had is trying to be consistent. I've had a lot of trouble here lately making sure that I have all of the information in the pipeline so that I can put those videos up on a regular basis. And so one of the things that David has done is he's got a set of us that kind of he knows he can call on to put something out there quickly. And so I've had to kind of come up with some of these things on the fly. He's thrown topics out there, and some of the stuff he suggests, the things he suggests are very, very close to what I have put together a lot of times. But usually what I'm doing is putting my own spin on it, or he'll say something and then I'll say, yes, that reminds me of this, or I just heard this the other day, and that dovetails well with that. So we have this sort of extemporaneous kind of agreement, so that he throws out a topic and I just write about it, or he'll say, I need something by Friday, can you do it? And I'll say, yeah, I'll figure something out, and I'll sit down and I'll just start writing. A lot of times I can put together 1,000 words, in a night on anything. You can tell I like to talk. So from that standpoint, I do a lot of the vomiting onto the page. He does a lot of the making it pretty and making it sound good. The editors for Fresh Perspectives and for all the blogs do a really great job of making us look good, which sometimes that takes a lot of work. So I don't have anything on tap right now. That doesn't mean you won't see anything coming out from me anytime soon. But
I did
have something next week.
I did put Geek Dad in the chat room there. I want everybody to check it out. Mm-hmm. Tell people what Geek Dad is. Dr. Geek Dad.
So Geek Dad in general is a website for geek Dads? No, it's actually lots of parenting stuff. There's actually a companion site called Geek Mom that's loosely affiliated. They both used to be affiliated with Wired Magazine back in the day. They've separated off from there. And back a few months ago, I got the opportunity to become an occasional contributor for them. And one of the things that I've gotten to be a part of that community, one of the things that we came up with was, we didn't have they didn't have a physician on the contributor staff. Actually, the new crew, Team Cthulhu, just came on board, and I'm part of Team Battlestar, which is the beta group. So Team Cthulhu just came online. There's another physician in that group. He's actually he does a lot of bench science too. So he's pretty smart guy, way smarter than I am. So I'm probably going to try to collaborate with him a little bit and maybe do some combination videos and some other things. But right now, Dr. Geek Dad was born out of this idea of there's not a lot of we had Mr. Wizard, and then we had Bill Nye, and we had Beekman, and we had all these other guys that were on television talking about science, and they were doing it in a way that was still respectful of the science, even though they were kind of goofy. I mean, there were still facts being thrown out there. And Bill Nye's still around, and he still talks a lot. And you've got Neil deGrasse Tyson and these other guys that are amazing at talking about stuff. But putting the Geek Dad spin on it, one of the things that we came up with was we could do quick segments, and we may do more long-form content. We haven't really worked out all the kinks on it yet. We're still playing with it. But we do these quick segments, 2-3 minutes long, about health topics, and we try to make them relatively concurrent with other things that may be going on either on the site or in general. Like I'm cutting one right now that's hopefully going to go up sometime this week. There's not much of this week left, but sometime this week, the episode about concussions and about head injuries and about safety for sports, because football season is in full swing. We just finished up with football season, soccer season.
Football,
go!
Okay, so
season's coming to a close there, and then you've got all of these other, essentially, all these other sports that have contact of some sort. One of the things I found out that I kind of recalled it vaguely, but I really probably didn't know it before I started doing the research on this, was that bicycling is actually the number one cause of head injury that leads to concussion.
Wow.
By numbers. I think it's just because you can bicycle all year round. Maybe I don't.
Are you talking to me? Because I bicycle a little bit.
And you wear a helmet. I've seen pictures.
Except that one picture where I didn't wear a helmet, and
and you got yes.
I got killed on that. 50 people were like, "Where's the hat?" I'm like, "Dudes, come on, give me a break." No,
it's true.
No, but I should have gotten called out on it. So yeah,
right. Well, and that's the thing is, there's this stigma about wearing your helmet, or about not leading with your head when you tackle, or about there's this whole sort of social and cultural thing that makes safety taboo or bad or whatever. It's not cool, and that's a problem. We need to overcome that. And so, talking about it in terms of it doesn't matter if you're wearing a helmet. There's no such thing as a concussion-proof helmet. That's one of the things that we say in the video that I'm working on. You cannot plan for every eventuality, and you're going to hit your head. It happens. Anybody here not hit their head before? Yeah, can't. And nobody raising their hand. Your head's huge. It gets in the way, and so the idea that even a small blow to the head, heck, you can have an indirect blow to the body that causes enough back and forth motion to cause the damage to the soft tissues of the brain. And so that whole idea of safety and being careful, and it doesn't have to be uncool to be healthy. That whole idea is one of the things that Geek Dad has always kind of talked about. When we talk about, whether it's talking about working with a 3D printer, or building things out of cardboard, or drawing comic books, or reading, or any of those things, it's always about, you can be interested in whatever you want to be interested in, but you need to do it in a way that's going to not only build you up, but also be safe and healthy and all of those things. So just that's the thrust of Dr. Geek Dad is to put out there some general information, some things that people can kind of glom onto quickly. And then I link back to all kinds of sources, usually a lot of stuff to familydoctor.org, a lot of stuff to the CDC and the WHO and NIH, places where you can get factual information that's composed on a level that people can understand. Most of the time you want stuff that's going to be at a 5th, 6th grade reading level. And, a lot of these places have that readily available.
Cool. So, geekdad.com. So, so shout out to everybody who are watching us live. Really very much appreciate it. If you came in late, we did talk about the closure non-closure story at the top of the show, and I will put the replay on my Twitter feed on drmikesavella.com. But just kind of summarizing, we summarize the story, and I think it opens up a wider type conversation about family medicine respect, family medicine representation at the academic level, at the medical school level, at the community level. I think people really need to get that story out there, and if people want to share their story with me, and I could put it on my blog or to get that story out there to help with that, because we as a community of family physicians, a family medicine revolution, we need to do that. So kind of closing up, I do want to cover a couple of things from the Congress of Delegates, actually 2 or 3 things from our annual meeting. Of course, we had elections, and our good friend Dr. Allen is in the chat room with us. Was elected. Good job there, buddy. And
congratulations.
And congratulations, sir. And I didn't pay him to do this, is my disclaimer. But I gave a lot of love to Family Medicine Revolution. He gave a lot of love to social media, telling the story of family medicine and primary care. So thank you very much for doing that. And we're glad that he's on the inside now.
Right.
To help get that in the boardroom to get people doing that type of stuff. So very much appreciate that. So I do want to cover a couple of resolutions. There was a bunch of them, and you can go to AFP,
yes.
go to AFP.org, and they talked about all of them. There's a couple of them I did want to cover. One is this is a story from October 12th. New AFP policy rejects non-medical immunization exemptions. And so for people who are not familiar with this, so, I like talking about immunizations. Immunizations work. Get your flu shot.
Yes, please. I just got mine yesterday. I'm glad you said that.
If you want to see people dealing some hate to me about immunizations, go to drmikesavella.com. And there are still anti-vaccine people out there, and they called me really bad names, Jerry.
I saw the first, when you put that picture up, I saw the first comment was somebody saying it was something about you faking your flu shot for the picture, just to shill for the vaccines.
Yeah,
because we get paid to give these vaccines. Yeah,
let me find that. So
we get money, but it's not like it's part of our job.
I know. So the debate was that the AAP should support non-medical exemptions, or rejects a non-medical exemption.
I was going to say, wait a minute, that's backwards.
Because what's been happening is that there's these states around the country who are like, oh, I don't want to get immunized for whatever reason. And our good friend Jay Lee was talking about that in California. They have this huge state level legislation that says, hey, we're doing away with exemptions. You have to get immunized because it is a public health issue. And it was interesting listening to the debate because, there were certain people out there who, have their right to say what they want to say. And they said, hey, we should have, people should still be allowed to be excused from them. And then the other side was like, oh, it's a public health issue. We should be immunizing everybody. I mean, not only children, but adults as well. And what it ultimately came down is that, the Congress supported a policy that rejects non-medical immunizations, exemptions. So I think that's a good thing. And I think our academy has to has to come through on that. One of the things that that I got really upset about, was during the second Republican debate when the candidates were talking about, MMR still causes autism and stuff. I was like, really?
Neurosurgeon. There was a neurosurgeon
talking about that
said vaccines were not that there should be exemptions and that people don't have to get vaccinated.
Exactly.
A neurosurgeon.
Right.
It blew my mind. And people that know me know this. I'm relatively apolitical. I don't really espouse beliefs from either side exclusively, and I definitely have things that I believe in that make both sides mad. Yeah, agreed. Nurse Pammy said a neurosurgeon that needs to get his head checked, and she's right. He definitely does. Especially when it comes to things like that. And that was the problem, is he was being more of a politician than a doctor at that point. And that's being untrue to yourself. But anyway, bottom line, I have no qualms with the way that this settled out at the Congress. I mean, I think the conversation and the discussion that I heard about, I didn't hear all of it, but I heard pieces of it. There was a lot of science, and there was also a lot of excuse me, I don't want to call it friendly debate, because it wasn't a debate. There's no debate. I mean, we know that
it was a discussion.
You have to, right. You have to have broad sweeping, compliance with vaccination programs in order for them to work.
Right.
The idea of herd immunity is one that is very, very important when it comes to some of these diseases. And it's one of the reasons why some of these diseases are coming back, because you now have a place for them to hide. So, when it comes to non-medical exemptions, I even if you want to have a religious exemptions, make it such that you have to have some type of, and I know our academy says no non-medical exemptions, and I'm fine with that too. But even if you have to be in a situation where you have a exemption for religious reasons, like California may have been one of these states that did this. There have been some states here in the Midwest that have done it, that you put the restriction on there that you have to have a note from your clergy member, and non-medical exemptions for religious reasons dropped by like 50 or 60% when states enacted those laws, because nobody was willing to go get that note from their clergy, because it wasn't a religious exemption. It was something that they were just saying that they didn't believe in the vaccine, or they thought it was going to cause trouble, or they didn't want to do it. And they used that as an excuse. So when you eliminate that, you eliminate a lot of the people that are using it as an excuse. If you have a good scientific reason, if you have an allergy to the components, or you have all those things, that's actually part of the process of giving the vaccination, if it's done correctly. I mean, we asked those questions. In fact, we started our flu clinics at the beginning of this week, as far as flu shot clinics, not flu clinics. We're not giving flu.
No, the flu does not cause the flu. The flu shot does not cause the flu.
The flu causes the flu.
That's right.
And when we talk about the flu is not nausea, vomiting, and diarrhea. There's no such thing as a stomach flu. I take issue with that term. People out there using that term. What you need to remember is influenza is a viral upper respiratory infection caused by the virus influenza. Flu is a specific disease. It's not just a word that describes feeling ill. It makes you feel like you're half dead. It is not just a simple head cold. And so, if you get the inflammatory response that you get after a shot, after the vaccine, we want that. We want to prove that your immune system is having a response, because what we are doing is trying to prime it so that when the real thing comes along, you can kill it before it kills you. 50,000 people a year minimum still die from influenza. And there's a soapbox here, but that's the whole idea of our academy saying, yeah, we need to follow science. It just makes sense. So I'm glad that we finally that we have that policy.
The anti-vaccine crowd is still out there. You see the link in the chat room. People are coming after me when I got my flu shot. So, I mean, we, especially all the health professionals out there, you have to say, hey, immunizations work. Immunizations save lives. One of the missed opportunities, I thought, was that the day after that debate, the American Academy of Pediatrics was all over that. Everybody goes to the American Academy of Pediatrics to talk about immunizations. What about the American Academy of Family Physicians? Do we have anything? Do we have anything nationally? I mean, come on. We do really good when it comes to health policy, when it comes to, payment reform. But when it comes to, come on. Get a statement out there the next day. That's all I'm asking. You want us to be leaders? You want us to be leaders clinically? Then get something out there nationally. So, All right. So yeah. And the other thing, the other resolution I wanted to talk about, which was very passionate, and I'm gonna drop this link in the chat room here, and having to do with something called the social determinants of health, which for people who don't know, I mean, there's a lot of different things out there that comes to having good health. And it's not all about genetics. It's not all about things like blood pressure. It's things about what's going on in your world.
You get to eat.
And in this link,
have a house.
People kind of scroll down to the bottom, and I'm going to read from this article from the AAFP. They talk about a resolution, and I'm going to quote here. Quote, this resolution having to do with police force. This resolution is asking that we as an academy recognize excessive or unnecessary force used by police officers is a public health issue. Violence impacts one's health, both mental and physical, and it doesn't matter where the violence comes from. And I have to tell you, Jerry, that I was there. I heard this very passionate testimony from people who felt like and were, violated, from police officers, or, had friends who were, or even family members, victims of this. And they kept saying, don't want to, make this a huge political statement. Don't want to take one side or the other or anything like that. But this is a story that we tell, that, we want people to know about. And,
Right.
Excessive, police force for whatever reason, sometimes it's just not justified. And there's a lot of people who said, the academy should not be taking these types of stands. It's divisive. It shouldn't do this. But it just hearing the stories about some of these people, I can't even imagine what people go through. Or what they think about when they're going through a town, or when they're driving, or when they get pulled over for whatever reason. It's just it's something that needs to change.
Yeah, I think too that the conversation was good. When it came to the idea of stigma and the idea of kind of fighting not just prejudice, but also fighting. Hey, Sarah's here.
Hey, Sarah's here. All right.
So the idea of not just fighting our own presuppositions, but just this idea that there's so much in healthcare that we have to be so careful of, that we don't let those cultural and mechanical biases, I guess is the best word that I can come up with, things that are just sort of automatic, those stereotypes, if you will. We can't let that drive what we do in medicine. It needs to be, we need to be impartial. We're here to take care of people. It doesn't matter if that person is purple or orange or, slightly pale, pink, red, whatever. It doesn't matter, if they have a beard, if they have no hair, if they have, one type of genitals or another, if they have no genitals at all. It doesn't matter. The whole point of these conversations is our profession is here to help people. And that's what it needs to be about. And our academy needs to recognize and take steps to make sure that we're putting that first. And there was a lot of discussion about the pieces that I was catching about that stuff. And that was one of the things that I was trying to jog my memory on the resolution there. One of the things that resolution, when you started talking about it, that actually came out of social media. We started talking about that at last year's NCCL. There was a Facebook discussion group that got started and has been going since May of this year, that brought forth a lot of these resolutions that you're talking about, and a lot of the things that we talked about with social determinants of health, and with the police brutality issues, and the issues of basically social injustice.
Right. Exactly. Right.
That are so pervasive these days. And so it was more about how do we make this about taking care of people instead of just about the political part of it. Like you said, it was more about, and the discussion was amazing. Some of the, like you said, some of those people just, I can't even imagine being in their position.
So yeah, I mean, I'm glad our academy is taking some stands with some of that stuff. There was a ton of other resolutions.
Yes.
There's
a resolution that got passed about getting videos made. I think I mentioned this to you. We need to try to get that contract. They referred it to the board. They referred it to the board because I specifically looked this up, and now it may have gotten switched around. I don't think it got pulled out, extracted for debate or anything, but. The idea of creating educational videos, I'm like, hey, doing that right now. I
think Alan has that resolution, so I think
hey, there you go.
Be extra nice to him and say.
It was funny because when that resolution came up, when I saw that was on the docket, I actually the permission to send Wanda an email about it, and I couldn't find it. I'm like, she does. It's like when she became president, she got deleted from everything that I have. And so it was like, you can't contact the president directly. You have to go through the appropriate channels, because that was actually one of the things. I'm serious. I really was looking for her contact information. I was like, hey, if this does go to the board, I know a guy.
Yeah, exactly. Well, I did tell the good president that we were having this little show here. So maybe
Shout
not her, maybe her people
right.
are watching.
Top men and women.
That's right. Yeah, she's too busy. She has people to watch this. So
when do we get people?
So yeah, call Jerry.
No, I'm not just me.
Well, they could start with you.
Yeah, and then I'll ring you. I'll ring you in just like I do every time.
Let's see.
You and Kevin and Jen and Kim and Jay and Robin.
I think that's all I have here this evening here, Jerry. So I think what I'm going to do is I'm going to before I pause the recording, I want to invite everybody to go to drmixville.com and follow me on Twitter. And Jerry, where can people find you at?
You can follow me on Twitter at Dr. Tolbert. I am also an occasional contributor for the Fresh Perspectives blog at AAFP.org. So the writings that we talked about earlier, especially the one comparing the doctors and the weathermen, is in that Fresh Perspectives blog. I write a lot about technology in medicine at that blog as well, and being a parent and a doctor and life work balance and physician burnout and all kinds of topics. And then I also am an occasional contributor for geekdad.com, which is where you'll find Ask Dr. Geek Dad. There are 2 episodes right now that are available about certain topics. And then this week, hopefully we'll get the episode out about the concussion management, or not really management, but concussion safety, head injury safety. I'm still trying to figure out what I'm going to call it. Well, it's hard to, like, there's nothing that rhymes with concussion.
I got nothing. I don't know. All right, I'm going to pause the recording here, and people want to jump in and talk to us, then we can do that. So check this out at drmixville.com. And of course, as always, Family Medicine rocks. Bye, everybody.
What did we decide we were going to call this again?
I have no idea. We're still working on it.
I thought we came up with